Vaccine fatigue. It's a phrase we've heard since the pandemic began, but a new study is shedding light on what effect simultaneous vaccines for both the flu and COVID are having this year and could have in the years to come. Millions of Americans chose to get a COVID vaccine and flu vaccination in the fall, and months later, that choice appears to be impacting flu cases now.
We're still going to face this challenge very likely in the next year or in the next few years. So this is absolutely way we should do to protect the public.
Dr. Xie Xie is an assistant professor of public health at the University of North Florida in Jacksonville. He co-authored a new study which finds dual vaccinations for COVID and flu reduces infections and hospitalizations, which at the same time can help lessen the financial impact of those illnesses.
This is going to really help us to reduce the cost from the individual perspective, also from the society perspective. So we want to send a very clear message to the public. We want everyone to understand it's very safe and efficient to take the flu vaccine and the COVID vaccine together, so you can protect you and protect your family, protect the community.
What we've seen is that it really tailed off, and right now we're really back to our baseline level of flu in most states in the U.S.
Dr. Stephen Thacker is seeing the effect of those vaccinations firsthand at the Medical University of South Carolina Children's Hospital in Charleston.
So many folks were making the right choice, to protect themselves and their community by getting their COVID vaccine or their COVID booster, that it created an opportunity to have the conversation around flu vaccinations. And it may be a big part of why we're kind of on par, if not a little bit better, with adults.
But there may be another reason, too.
There's some interesting data there that, gosh, it's real clear that, at least in the U.S., we've become much more comfortable with getting our vaccinations in pharmacies. So it's just better access points, because we certainly have far more access to pharmacies throughout the U.S., especially when we think about rural communities.
However, not everyone is doing well when it comes to the flu.
There's areas where we really are falling behind compared to our last flu season, specifically pregnant women and in children.
The CDC announced in February that, for the first time since the pandemic, pediatric flu deaths surpassed more than 100 in the country. Experts caution it's important for everyone, no matter their age, to not let their guard down.
Flu season's not over. We know that it can extend into April or May, and one of the questions and worries is, will we have another surge of influenza late in our flu season?
A question that will be answered in the coming months. Maya Rodriguez, Scripps News, Charleston, South Carolina.